Hello, everyone. If you have ever struggled with expanding those scripted case notes into well structured professional sentences, this video is for you. Today, I'm going to take you through an easy step by step approach to transforming OET case notes into a polished, natural, and concise writing. So, by the end, you will know exactly what to include and what to leave out and how to structure your sentences for maximum clarity. So, let's get started. The first step is you need to understand the purpose. So before we expand, we want to make one thing very clear. Your letter is not a copy paste exercise, right? It's about turning brief case notes into clear, grammatically correct, and logically connected sentences that make sense to a busy healthcare professional. For example, if your case note says like this, BP is 180 by 110, headache into 3 days, no HX of HTN, advised urgent referral to cardiologist. So these are the prompts example that you make a case note out of it. So here you wouldn't just write the patient has a blood pressure of 180 bar 110 and a headache for 3 days. There is no history of hypertension. Urgent referral to cardiologist was advised. That sounds very robotic and unnatural. Instead, try to explain it meaningfully. So you could have written in such a way that Mr. Smith presented with a severe headache persisting for 3 days. His blood pressure was significantly elevated at 180 bar 110 despite having no prior history of hypertension. Given these concerning findings, an urgent referral to a cardiologist was recommended for further evaluation and management. Easy, right? Now you can find out the difference. Why this version is weak and why this one is the best. Right. So if you're saying this example, the better version, here the words are flowing in a very natural way. It is adding more clarity and you are keeping it professional. Got it? Now, the next step that you need to concentrate on, where it's like a biggest mistakes many candidates make, is writing short, choppy sentences. They will make overly complex ones. So here the key is balance. So step two, we are going to focus on using the right sentence structure. So here is another case note example. If you see here, cough is for 2 weeks, worsening, productive yellow sputum, mild fever, and smoker for 20 years. Diagnosis is suspected chest infection, and prescription is amoxicillin 500 mg TID into 7 days. So here, how your case note should not be, we will see that first. How you're not supposed to write. If you're writing in a way like the patient has had a cough for 2 weeks, it is worsening. He has yellow sputum. He has a mild fever. He has been a smoker for 20 years. A chest infection is suspected. He was prescribed amoxicillin 500 mg 3 times a day for 7 days. Do you think this one is the perfect version? No, here again it sounds so robotic. So, how you can refine it? Mr. Adams has been experiencing a progressively worsening cough for the past 2 weeks. So, you can just mention the patient name here, accompanied by yellow sputum and mild fever. Given his 20-year smoking history, a chest infection is suspected. He has been prescribed amoxicillin 500 mg 3 times daily for a week. Sounds better, right? So here you can see how the flow is very natural and also you're keeping it concise and relevant details. And the next one we are going to see is how to link your ideas smoothly. So your letter should flow logically rather than reading like a list. So try to use something like linking words and phrases, such as you can use like given that, in light of, due to, therefore. So try to use linkers more. Okay, so here is another example. 65-year-old female and CC is knee pain for 6 months. Findings are like swelling, stiffness, and the diagnosis is osteoarthritis. What is the advice given here is physiotherapy plus analgesics. Okay, so let's see how your best version should be first. Mrs. Thompson, so you're going to mention the patient name. A 65-year-old female has been experiencing knee pain for the past 6 months, accompanied by swelling and stiffness. In light of these symptoms, she was diagnosed with osteoarthritis and has been advised to undergo physiotherapy along with analgesic medication for pain relief. So can you see like how nicely we are using the linkers over here? So try to use the linkers as much as possible. And if you see this version, the weak version, the patient is a 65-year-old female with knee pain for 6 months. She has swelling and stiffness. Osteoarthritis was diagnosed. She was advised physiotherapy and analgesic. So here the flow is not very logical and we are not using any of the linking words here. So if you add logical connection, it sounds very professional and also the flow will be in a very smooth manner. Got it? Let's see some of the common mistakes and how you need to fix them. So the mistake number one is overcomplicating sentences. If you are saying like the patient, a 45-year-old male, has been experiencing persistent abdominal pain for the past 14 days, which has been interfering with his daily activities and significantly affecting his quality of life. If you see this example, then this one is like overly complicating sentence. You are making use of more complex sentences rather than giving it in simple terms. So instead you can use like the patient, a 45-year-old male, has had persistent abdominal pain for 14 days impacting his daily activities and quality of life. Got it? And also don't use informal language. Okay, if you're saying the patient was feeling really bad with a lot of pain and didn't know what to do, no, this is not the right way of approaching, right? Instead, you have to use formal language and writing. The patient reported severe discomfort and sought medical advice. Simple, right? So try to use these strategies. Now it's time for us to practice. So you can pause the video, take a pen and paper, read it by yourself. It's an example and you're going to make a case note out of it. Remember the strategies that we have covered so far. Try to identify the purpose, write it properly as an introduction, and then go further with the appropriate sentence structures. Don't use overly complicated passages or sentences, and try to make the flow in a very logical by using linkers and connectors. Got it? I will also rate it for you. So the CC here is chest pain for 2 days, and the findings are no previous cardiac history, non-radiating pain, worsens with exertion, and the ECG report is normal. Plan is monitoring and advise lifestyle changes. So once you are done with the case notes, you can check it. You can analyze and assess by yourself whether you have followed all the steps that we have covered so far. Then final thoughts for the day. Expanding case notes, it's like an art and science that you need to balance clarity, conciseness, and relevance. With practice, you will master the skill of writing like a professional, well structured OET letter. I hope this breakdown has helped. So if you found this useful, kindly like, share, and subscribe for more OET tips. Drop your questions in the comments and I'll be happy to help you. See you in the next video. Bye bye.